All right, today's video is a hopefully short video about newborn assessment, and I'm taking most of this information from Varney's Midwifery, this hefty book right here, and this is talking about primarily in the first minutes to first few hours of life of a newborn. So assessment of a newborn for a caregiver nowadays usually begins before the birth even occurs. Fetal heart rate is of particular importance, and variability is one of the keys because it really shows adaptability. Everybody's heart rate changes in response to stress and also to changes in their environment, and variability shows that they can adapt to these different changes. And so as the baby navigates the birth, it's normal for these variations to occur. Newborn assessment for a midwife then truly begins when the baby is crowning. The color of the scalp can be observed, and if she felt it was necessary to touch the baby, which is not normally advisable when the baby is being born, she may check the capillary refill of the baby's scalp by pressing gently on the scalp tissue and then pressing until it turns pale and then releasing. And good color and a quick refill after blanching are good signs of adequate perfusion. At the moment of the birth, she may then assess with her eyes and maybe with her hands as well the baby's tone, so muscle tone primarily, and skin color, and also search for any obvious physical deformities. The heart rate can also be palpated at the umbilical cord close to where it inserts into the abdomen within the first minute or so before it really starts to change. And that can be a way to assess for the heart rate of the baby shortly after birth. After this, the baby will be placed on the mother's abdomen and covered with a warm blanket, and the midwife will then watch for signs that the baby can clear mucus and take its first breaths. APGAR scores are the most common way to assess fetal transition to life outside the womb, and they're taken at 1 minute and at 5 minutes post-birth to assess infants. And while there are some correlations between a score of less than 3, which I think it's out of 10, so less than 3, and the highest incidence of death in the first 28 days of life, so there is a correlation between those two factors. Low scores at 1 and 5 minutes are not necessarily predictive of neurological damage, and on the other hand, a high score is not always predictive of health long-term for an infant either. The best and sole use of APGAR scores at the time when Varney wrote this was to evaluate the newborn to assess its need for resuscitation. So the primary use of that was resuscitation, not general health and well-being. So after this, there's a transitional period after birth from the first few minutes outside the womb to the first 6 hours or so. And I hadn't actually heard this broken down in this way. There's 3 stages that she talks about, and I'm going to go over them quickly here. So the first stage is a reactive period lasting about 30 minutes. The second stage is an interval from about 30 minutes to 2 hours where the baby sleeps. And then from 2 hours to 6 hours is another reactive period where there's other changes that occur as well. So after the birth, an infant can have experienced stress during the birth, and there's so many new changes, lights, temperature, all of that. And the infant should really be allowed to stabilize before being handled or given any very involved tests or assessments. A healthy newborn has an instinctual response to look for the breast and to suckle within usually the first hour, which should absolutely be supported whenever possible. Then getting into the 3 stages. So the first stage is a period of reactivity when the baby would have their eyes open and show alertness. They're really looking at their mom and their dad if they're holding them. And contact with the mother is very important at this stage, and we should definitely support and facilitate that whenever possible. And at this time, the baby will show increased muscle tone and will flex the upper limbs and extend the lower limbs. And this actually helps to mold the baby to the mother's body while being held. Then in the second stage, the baby's breathing will slow somewhat, it becomes more even, and the baby will actually sleep pretty deeply. The newborn shouldn't be disturbed at this time, and this deep sleep is really allowing the baby to recover from the demands of birth and also from the transition from life inside the womb to outside the womb. Then that lasts till about 2 hours, and then from about 2 to 6 hours after birth, there's the third stage, which is also a period of reactivity, similar to the first. So at this stage, the heart rate is variable, and the baby may have swift changes in color as well. The baby may be interested in breastfeeding, which should definitely be encouraged if they're showing interest. And really interestingly, she listed that feeding at this stage can actually have numerous benefits, and which is probably obvious, but she really articulated them quite specifically. So number one, it helps with prevention of low blood sugar or hypoglycemia, which can be an issue after birth for infants. It helps with stimulation of the bowel and stool passage, which is also important to get that gut system really online and working in the first few hours to day or so after the baby's born. It also helps to prevent jaundice, which can be a concern for a lot of people, and also a lot of babies do experience that. And fourthly, it helps with positive bacterial colonization that leads to the development of vitamin K by the intestinal tract. So a lot of people know that babies are born without vitamin K and without that body system really being present. And so we often will give babies vitamin K through an injection shortly after birth, but it actually will naturally develop within the first few hours to days of birth, especially with breastfeeding, and if that's really supported and facilitated in the first few hours to days. So over the next few hours and days, the baby will stabilize and various systems will come online. Things will really start to build, the gut flora will build, sleep systems will get more in a rhythm, and a lot is happening in this first 6 hours or so. But I really think this is a helpful framework for us to really understand the most important assessment criteria and how to understand what is happening when it seems as though the baby may be changing super quickly from hour to hour or even minute to minute in those first few hours of life. So yeah, hopefully I explained that in a way that makes sense. And if you learned something or thought it was interesting, definitely happy to talk about it more. So yeah, thanks for watching, and I'll see you next time.